The technology got to where it needed to be, the software was available, and the funding was available, and that was probably the most important thing, certainly to convince my colleagues that it's worth looking at this, that it's the right time and we were going to get some help with the funding, because it's not a cheap proposition by any means, and as we've gone through this, we've seen that it's not cheap, and even though the funding is there, it's not remotely close to 100%, but I think without that funding, without that kickstart, we never would have got going. I would say about every third or fourth patient now I have enough information on their electronic medical record that I go in without a chart, and it feels strange. It feels really strange walking into the office with nothing, just my stethoscope and my pen, which I don't really use very much anymore, and just sitting down and talking to the patient. So it's a sea change in the way we do things. So yeah, certainly trepidation, but as we get more comfortable, as we get more confident that the EMR is going to be there, that when I switch it on or switch on that patient's file, it's going to be there, I think we'll be more and more happy with it. It tells me up here that there are 6 transactions, which means there are 6 lab results, x-rays, discharge summary, something waiting to be dealt with. One of them is abnormal. So what I do is I click on transactions. That brings up the list, and 5 of them are in black, 1's in red. So I'll click on the red one. And what I find there is that this particular patient's hemoglobin is low. So then all I have to do is click on the medical record for that patient. It comes up here. It tells me this particular patient had a heart attack a couple of weeks ago. And they were doing pretty well, but they're feeling really tired. I saw them yesterday, this patient. I now know that their hemoglobin is low, so I can now call them back in and tell them, this is why you're feeling tired. This is how we're going to deal with it. So within 24 hours of them seeing me, I've got the results that I need, the information that I need, and I'll see the patient either later today or tomorrow. So that's just one example of how I'll use the system. What this does is it's allowed me to double check with the patient. This is really what you're taking. You know, it does drug interaction checking. We make sure everything's okay. Once it's in there, then when the patient comes next time for their repeat, I talk to them, I check their blood pressure, do whatever I need to do. They need that one, and that one refilling. Click, 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 print, prints out, sign it, and away it goes. Pharmacists can read it. There's very little chance of error. So again, a huge improvement. It makes my life easier, makes the pharmacist's life easier. The number of phone calls I'm getting from pharmacists because they can't read my handwriting has gone to practically 0. I would say absolutely, yes. Take the plunge. Again, I would certainly walk them through it, show them how it works, and I think that's probably more beneficial than talking to the vendors, because they're obviously trying to sell their product and they're very, very good at it. I think I would walk them through it, I would show them how it works, I would get them to talk to our MOA, and I would get their MOA to talk to our MOA, so that they can discuss how beneficial it is. And yeah, sure, do it. The first thing I would say to other doctors is talk to your colleagues who have done it, go and see how it works, spend some time with them, and probably you'll be convinced that it really is worthwhile. When you see the huge difference immediately in the amount of paper that we had to deal with, that on its own is pretty convincing. Talk to people. I would say that if you're not happy and not comfortable, don't do it yet. But what I would say is that we've come a long way from where we were 5 or 10 years ago, that the people who were implementing EMRs at that time were the real pioneers. And if you look around now, the people who are implementing it are average doctors, people who a few years ago would never have considered it, but really are doing it now. And you talk to pretty well anybody and they'll say that it was tough, it's hard work, but they would never go back. One or two have expressed some concerns about confidentiality and security, privacy, and I've been able to point out to them that it's actually much more secure than our old paper record, which had charts just everywhere that anybody could probably get hold of. I point out to them, with systems we have in BC, none of the information is stored in our office electronically. It's all stored on a secure server somewhere else with military-grade security. Nobody's going to get into that. The horror stories you see of people having laptops stolen with information on it, or computers stolen. If this computer is stolen, it's no use to anybody. There is no patient information on it whatsoever. So people seem to be reassured by that. I would have no hesitation whatsoever now in 2010 in telling other doctors that this is something you should do. 5 years ago, I would have had a lot of hesitation, which is why I didn't do it, because I don't think we were there. With the way information flows into us now, particularly in Kelowna, in the Okanagan, I would say absolutely it's incredibly beneficial for you as a physician, for your staff, and absolutely for your patients. It's amazingly archaic. It's amazing how long it's taken us as physicians to actually do this, but everything's coming together at the right time. Funding is beginning to be there. The younger physicians are prepared to do this, and it's going to happen.